Nexplanon is one of what's called the long-acting reversible contraception, so it's birth control that can last for quite a long time. It's a little plastic rod that goes in your arm just under the skin right here. A lot of people refer to it as the birth control implant. The Nexplanon has one hormone in it called progesterone that it gets released under your skin where the implant is, but circulates through your body and causes your body to suppress ovulation or to not ovulate so that you're not able to get pregnant. And it also thins the lining of your uterus so that a pregnancy wouldn't be able to implant there. It is very, very effective. It's over 99% effective and is one of the most effective reversible forms of birth control that exist. Nexplanon can last for up to 3 to 4 years. It can be taken out sooner, so if there's something that someone doesn't like about it, or if they decide that they want to get pregnant sooner, they can have it taken out sooner, but it can last as long as 4 years. The biggest side effect with Nexplanon is that it does change your bleeding pattern and causes irregular bleeding. So most people have some kind of change in their periods. Some people won't have periods at all, but a lot of people have irregular spotting and irregular bleeding. So that is one thing to consider with Nexplanon and to be prepared for. One of the more rare risks of Nexplanon would be infection from the insertion procedure or from the removal procedure once you have it taken out. So some people that have used the Nexplanon do experience weight gain or can experience acne. When they do studies of large groups of people, they don't find that it tends to make people gain weight necessarily, but it can affect people's bodies differently, and some people may have had that experience. One other very rare possibility or thing that people sometimes talk about or hear about with the Nexplanon is that it can move location in the body. When we place the Nexplanon in your arm, you're able to feel it right away. So you can always feel it to make sure that it's in the right place. Typically in those rare occasions that it moves, it's because people have been purposely pushing it or moving it, and it's very unlikely that would happen if you weren't doing that. And like I said, you can always check, just feel it with your fingers and make sure that it's still in the place that it should be. You can get pregnant pretty much as soon as the Nexplanon is taken out. The return to fertility is pretty quick.